Good afternoon, everyone. Thanks for joining us for our webinar today. My name is Gabriele Colasurdo. I'm the Manager of Education and Patient Services at Myeloma Canada. Before we get to the presentation, you'll be hearing about the Kinatex Sport Physio Oncology Rehabilitation Program. But before we get to the presentation, as I usually do, we're just going to thank our sponsors. So thank you to Amgen, Binding Site, BMS, Janssen, Takeda, and Sanofi Genzyme for their support. Without their help, it would be very hard to do these and to do them as often as we do. As many of you know, all the webinars are recorded and they're uploaded onto our YouTube channel. So how do you access the recording? You go to youtube.com or from your phone on the YouTube app. You just type in the search bar, you type Myeloma Canada. One of the first links you'll see is going to be our channel. It looks like this, like what you see on your screen. Clicking on the big red button will subscribe you to our channel. And once you subscribe, you're going to see a little gray bell icon. Clicking on that will enable notifications. So basically, every time we put a new video on, you'll get a little pop-up on your phone or on your computer saying that a new video has been uploaded. That's a good way to stay up to date with all of the latest webinars that we've been doing. You can also access the webinars from our website, myeloma.ca, clicking on the resources button here on the menu. A bigger menu will open up. You just click on educational videos, and that'll just send you off to our YouTube channel where you'll be able to see all the videos. Lastly, how do you ask questions? So I encourage you to please send in your questions during the presentation. I'm going to receive the questions and I'm going to ask them to our presenter at the end of the presentation, and we'll have a chat that way. So without further ado, I'd like to introduce you to Amanda Greeley, who is a physiotherapist and the coordinator of the oncology program at Kinatex Sports Physio Dorion and the one in the West Island as well. Thanks, Amanda, for taking the time to join us today.
Thank you, Gabriel, for having me, and thank you everyone else for joining us today. I also want to thank Myeloma Canada for having me. So today I have the great opportunity to speak to you about a subject that's very close to my heart, cancer rehabilitation. So as Gabriel mentioned, my name's Amanda. I'm a physiotherapist and I'm a lymphedema therapist working in cancer rehabilitation at Kinatex Sports Physio. Over the past 4 years, we have grown this service and we have developed it to really address so many unmet needs of cancer patients and survivors out there. So firstly, what I'm going to go over is really what is cancer rehab, give you a little bit of a definition about it, explain why it's important, and then I'll jump to our services. But in between there, I'm gonna come back to really what is myeloma, what are the side effects, what are the complications, so that you have a better understanding of exactly how our services could be of potential help for you. So what is Kinatex Sports Physio? Essentially, we are a banner of private clinics, mostly located in Quebec. We do have one clinic in Ontario, and we are really a multidisciplinary center. So what that means is that we offer a wide range of services, including physiotherapy, occupational therapy, massage therapy, acupuncture, osteopath, nutrition. Those are just to name a few. And we really help clients from a preventative aspect all the way until rehabilitation. And in addition, what's really important is that we're an interdisciplinary team of therapists. So what that means exactly is that we collaborate and we work together to really help our clients achieve their goals and address all their needs and concerns. So why is cancer rehabilitation important? I'm sure, as you're aware, there have been so many advances in terms of the detection, but also medical interventions for cancer within the last few decades. And luckily, that has greatly increased cancer survivorship. However, nonetheless, as I'm sure you're also aware, there's a lot of side effects related to cancer and its treatments. And many of these side effects can have significant impact on our body, leaving us with many physical, cognitive, and emotional side effects. As you can imagine, all of that can and probably will have a great impact on your function, your quality of life, your well-being, your ability to do day-to-day tasks. So that's why really cancer rehab has grown within the rehabilitation world. So many people are aware of all these side effects. However, not many people understand or know that these side effects can actually be long-lasting, and some people may unfortunately experience them for months or years after their treatment. So by definition, cancer rehab really involves helping a person with cancer achieve maximum physical, social, psychological, and vocational functioning within the limits imposed by the disease and its treatments along the continuum of their cancer care. And what I really want to highlight here is the continuum of their cancer care. So what essentially that means is that cancer rehab plays a big role from the moment of diagnosis all the way up until years after the end of treatment. So we really do have a role throughout the continuum, and there's always something that we could really help cancer patients and survivors with. There's been a great deal amount of research over the past few years in terms of cancer rehabilitation, and research really does support it, in addition to exercise for playing a vital role in both preventing and reducing these side effects that I'm talking about. And it's really using that interdisciplinary model of care that I mentioned, where we're helping individuals to return to work, return to their home life, return to their activities during their treatments, after their treatments. So really, like I mentioned, along the continuum of their cancer care. So our goal is to really just help people live beyond their cancer and get back to doing what they love. So we're going to talk a little bit about myeloma. I'm sure you're all very familiar with it. So as you know, it's really a cancer associated with abnormal growth of the plasma cells. So these plasma cells are a type of a white blood cell, so they're super important into your immune system. In addition, they are produced in your bone marrow. So it's the spongy tissue found inside bone. And it's within your bone marrow that many other blood cells are also produced, like your red blood cells, other white blood cells, and your platelets. And like any other type of cancer, there have been so many advances within the medical detection and treatment, so more and more people are living longer. But as I mentioned before, there's so many more people living longer with many side effects. So we're going to go over a few of those side effects just so you have an idea of how later on when I explain our services, exactly how we could help. So for an active myeloma, there's quite a few different side effects, and they're really all related to kind of the increase in plasma cells within that bone marrow. So they're pushing out essentially, crowding out, I should say, the red blood cells. So there's decreased red blood cell production, which leads to anemia. There's also an increase in these M proteins, which can lead to poor functioning of the kidneys. There's hypercalcemia, which is essentially elevated blood calcium levels, and osteolytic lesions, which I will explain in the next slide. So bone complications is probably one of the biggest areas in cancer rehabilitation that we could definitely help with. So typically what happens is our bones are constantly undergoing this remodeling process, and the way that it does that is through two cells. So we have our osteoclast cells, and these are our cells that break down bone in preparation for new bone to be laid down. And we have the osteoblast cells, which do the complete opposite. They're really the ones that build new bone. So normally there's a really nice balance between destruction and formation so that our bone mass remains stable. However, in the case of myeloma cells, what happens is there's this imbalance in these two cells. So there's an increased stimulation of osteoclast cells and a decreased production of osteoblast cells. So what happens is that there's areas of the bones that become damaged because there's too much breakdown, and there's also thinning of the bones as well. So when you have those areas of damage, you're going to have lytic lesions or osteolytic lesions, which can increase the risk of fracturing in that specific bone that's affected. Osteoporosis, like I mentioned, is really that thinning of the bone, so decreased bone density that's also going to arise because of this imbalance. And as you can imagine, bone pain is something that could happen as well. Anemia, like I mentioned, it's another common side effect, and it's really related to that decrease in red blood cells. Essentially, because of all these plasma cells, there's decreased production of red blood cells. And your red blood cells are very important because they carry a certain protein called hemoglobin. So what hemoglobin does is that it carries oxygen from your lungs to the different parts of your body to give you essentially energy and stamina. So when you have less red blood cells, you have less hemoglobin, and essentially you're going to have possibly anemia. There are many side effects of anemia, one of the biggest ones being fatigue. So of course, if you don't have that hemoglobin and oxygen to provide you energy and stamina, you're going to have fatigue, shortness of breath, weakness, dizziness, headaches, leg pain, and difficulty concentrating are just a few of the side effects. Infection is another important one. Like I said, myeloma kind of crowds out your red blood cells, your white blood cells. So at the end of the day, what happens is you have a lower amounts of white blood cells, but you also have a decreased production in your antibodies. So it makes you more vulnerable to infections, more susceptible to infections. You might have repeated infections, or your recovery time after an infection might be longer as well. Renal damage, like I mentioned before, your myeloma cells produce a protein called M proteins. And these proteins, like any other protein in our body, are really cleared out by our kidneys. However, what happens is sometimes when that M protein is too elevated, our kidneys are working overtime to eliminate it. So what happens is our kidneys can become damaged, and in some cases that could lead to kidney failure as well. There's also elevated levels of blood calcium. So before I mentioned that balance of osteoclast cells and osteoblast cells, and our body is constantly undergoing this remodeling process. And as I mentioned, in the case of myeloma, what ends up happening is that there's that increase in bone breakdown. So when you have increase in bone breakdown, you have an increased amount of calcium that is released into the bloodstream, and that could increase that level of blood calcium. So what happens is that symptoms related to that could include constipation, frequent urination, weakness, and confusion. There's also other blood complications, like I mentioned. Your myeloma cells are really crowding out different types of blood cells in the bone marrow. So one of them being the platelets. Your platelets are a very important cell for blood clotting. So when you have a less amount of platelets, you might have an easier time and excessive bleeding or bruising if trauma happens to the limb. There's also the complication of blood clots. So certain medications that you may be taking for treatment or to even reduce some of your other side effects may cause you to be a little bit more at risk of having a blood clot. And there's also blood thickening. So those high levels of M proteins that I was mentioning before actually can thicken the blood and increase the viscosity of the blood. So it makes that blood flow a little bit more difficult when it tries to get to various parts of your body. And pain. So there's three really main different types of pain that are commonly associated with myeloma. The first one being bone pain. And as you can imagine, like I explained before, there's that bone damage, there's fractures that can occur just because of that inactivity of those osteoclasts and osteoblasts. And what happens is that you have that thinning of bone, so you could experience bone pain. There's also nerve pain that could be associated with a compression fracture. For example, a compression fracture is essentially where your bone is essentially, if you think of compressed, and there's many nerves associated all around bones. And essentially if that happens, what could happen is that a nerve could be squished or compressed. So what happens is that you'll experience a type of nerve pain. The third one being neuropathic pain, so a peripheral neuropathy. And this one is often mostly associated with chemotherapy. And what most of my clients experience or their complaints are is really that they feel a tingling or numbness, a burning, shooting, or electric type pain, mostly located in the feet and or hands. And that pain usually has what we like to say a stocking glove distribution. So what that means is that pain could be in the feet and it could extend up the leg, or the pain could be in the hands and extend up into the arms. And it's really described as tingling, shooting, decreased sensation, or even increased sensation to touch. So touching something that wouldn't normally cause you pain now causes you to experience pain. In some cases, you could also experience weakness in the foot or in the hands. So you have difficulty with buttoning different things, difficulty with cutting, difficulty with opening doorknobs, opening jars. And in the feet, you might notice that you're frequently tripping. Those are common signs of weakness associated to the peripheral neuropathy. In addition, we have diminished reflexes, which happens a lot less often than the other ones. So in addition to all of that, there's also the side effects of the many medications that you may be on, from chemotherapy to immunotherapy to just really medications that you may be on to combat other symptoms, may be causing a different number of symptoms. So there's the nausea and vomiting, hair loss, mouth sores, loss of appetite. But I think the most important one that I want to just pull out here is really insomnia. And that's what we see with the majority of our clients that we see in clinic, is not only is there fatigue, but there's also insomnia. And in cancer rehab, there's a lot that we work on to help clients kind of combat that insomnia, in addition to mood and emotional changes. So overall, the goals of myeloma treatments really kind of align with our own goals in cancer rehab, and you'll see that later on. So really the goals of myeloma treatment is to prevent the production of those abnormal cells. It's to strengthen bone and prevent fractures. It's to increase the amount of red blood cell count so that you're reducing fatigue, reduce the risk of infections, and promotes overall well-being and quality of life. So I'm going to talk about our oncology rehab services at the moment. So our program really was developed in collaboration with quite a few experts in the field of oncology. We consulted many oncologists, medical oncologists, radiation oncologists, and we've really developed this multidisciplinary services, and like I said before, to really meet the unmet needs of cancer patients and survivors. And our main goal is to help cancer patients optimize their function, their well-being, their quality of life throughout their entire cancer journey. Like I said before, really we are there to educate and provide guidance from the moment of diagnosis up until years after treatment. So our goals, as I mentioned, is to reduce your pain and fatigue, improve your strength and endurance, improve your daily function, improve your independence, improve your well-being and quality of life. So as I've said a few times already, we are really there throughout the continuum of cancer care. So our services are adaptable. So if someone is newly diagnosed or undergoing active treatment, or they're in remission, our goal is to help them overcome any side effects that they're experiencing, but also help our clients achieve any goals that they may have. And one really important part that I want to emphasize is that all of our services are individualized to the client. So what that means is that the first time you meet one of the therapists, we do a very long history to get to know your concerns and your needs and your goals. And we will create a plan with you to really work on the things that you want to work on. So it's very customized. However, at the same time, we're always working to improve your function by reducing symptoms. So there's many different symptoms that we could work on reducing, such as pain, weakness, fatigue or loss of energy is a really big one, decreased limb movement, limited mobility, so difficulty walking, postural changes, decreased balance and coordination because of that neuropathy, that decreased sensation in your feet, you're tripping more often, you have decreased balance. There's also swelling that occur. There's that peripheral neuropathy, cognitive difficulties, difficulty participating in your hobbies or activities, or difficulty with physical or mental tasks at home or work. So as I mentioned before, our team is really, it's really a interdisciplinary team that we have, composed of physiotherapists, occupational therapists, acupuncture, massage therapy, kinesiology, athletic therapy, osteopath, and nutrition. And our team, over the past few years, we've grown our team, and these are people who are uniquely qualified in cancer rehabilitation. So they have the knowledge to treat any type of cancer patient. So they're able to know precautions or contraindications. And essentially, like I mentioned before, our goal is to work closely with you and your oncologist to provide you that personalized plan that really is to meet your needs and concerns and essentially help you to establish your goals. So what is the role of each therapist? I just listed a whole bunch of therapists. Sometimes it could be a little bit confusing as who does what, and depending on your needs, you definitely you wouldn't have to see any of those. So I'll explain a little bit about what each one does to help guide you if you're interested in ever seeing one of the professionals. So as a physiotherapist myself, our biggest role essentially with myeloma clients is really the prevention of fractures. And our biggest way that we're going to do that is by giving you targeted exercises to help promote bone remodeling. So helps to strengthen your bones. And we're going to give you certain exercises that really we're going to avoid a little bit the areas that are a little bit more fragile and work on strengthening areas around to provide you with better stability. We're also going to use therapeutic exercises to improve your strength and endurance, therapeutic balance and coordination exercises to reduce your risk of falling. Of course, falling is probably one of the biggest causes of fractures, so preventing falling is very important, and working on balance and coordination is the way to go about doing that. But there are also many modalities that we use in physiotherapy to reduce bone and nerve pain. We can also use a desensitization or sensory re-education program to improve symptoms of peripheral neuropathy. So what that means exactly is that, for example, if you're experiencing decreased sensation in your feet or your hands, there are techniques that we use in physiotherapy to improve that sensation, to help you normalize that sensation and to help you get a little bit more function back. So to say, if you're having difficulty buttoning a button or opening a door, our goal is to help you be more functional in performing those movements. Or on the other hand, if you're someone who's having a painful sensation in your hands and feet, to light touch. So for example, if you go to grab a glass and you feel pain, that's because your nerves are oversensitized. So we have different programs to also help normalize that. As a physiotherapist, we do a lot of hands-on techniques. So we use a variety of hands-on techniques to help you improve movements of a certain limb, improve your back movements. However, our biggest role is probably in education. We are there to help educate you. And two ways which we can do that is helping to educate you on optimal positioning for sleep and rest, and optimal positioning for transfers to prevent fractures. So what I mean by that is how to go from lying in your bed to sitting properly so that you prevent fractures, or how to go from sitting on a chair to standing up, or sitting on a low toilet bowl to standing up. There's many different techniques that are used to ensure that we're moving properly to avoid injuring ourselves. So we do a ton of education. Next, we're going to talk about occupational therapy. So an occupational therapist's role is really to help a person maintain their independence with their daily activities at home or at work. And what they do is that they take into account your current medical condition, but also your environment, so that they are there to kind of help you adapt your environment so that it's better suited for you. So what they could help you with essentially is functional adaptations. So if you're having a little bit of difficulty walking because you're experiencing numbness underneath your feet, they could provide you with different walking aids or splints. They also play a big role in guidance for return to work or meaningful activities. So they could help you figure out what's the most appropriate plan for your return to work depending on your concerns and needs. so that you slowly go back. So your return to work is progressive and it's not overwhelming if you're experiencing many different side effects. So home and work adaptations is also something that they could help you with. So like I said, again, if your toilet seat, for example, is too low, they could evaluate your toilet seat and recommend that you have a raised seat. Or in the shower and bath, they could recommend different bars. They can also do the same thing at work. So they could assess your work and see if you're, for example, if you have an office job, if you're properly positioned so that you're not in a position where you're going to have increased aches and pains or you're at risk of injury. They're very great at giving therapeutic exercises and energy conservation techniques to help you improve your fatigue levels. They do a lot on education on the prevention of falls, and they are great as well with giving different activities and techniques to improve chemo brain, so to improve that mental fog, to maybe help you get ready to go back to work or a certain activity. So really they have this holistic approach of helping clients to improve their function. Next, we're going to talk about acupuncture. So acupuncture has been shown to be very effective in the field of oncology for reducing a number of symptoms, such as shortness of breath, anxiety and depression, chronic fatigue, pain, peripheral neuropathy, and even nausea and vomiting associated with chemotherapy. It's been shown to be very effective in decreasing inflammation, improving blood circulation, and improving healing as well. Massage therapy. Many of us are already aware of massage therapy, the benefits of massage therapy. So really, massage therapy helps you to reduce any type of muscle pain, myalgia. They help to reduce muscle tension, but they also help to improve blood circulation and mobility of a certain part of your body. It also is very great for improving sense of well-being and reducing stress and fatigue as well. Next, we're going to talk about kinesiology. So kinesiologists are really experts in exercise prescription. And before I talk about that, I just want to talk a little bit briefly about, is exercise safe? It might be a question that you ask yourself. I'm at risk of fractures. Is it safe for me to perform exercise? And at the end of the day, the answer is yes, but it's important that you speak to your physiotherapist, your kinesiologist, and even your oncologist, so that they're able to kind of give you a program that's best suited for your needs and the areas of where you might have a weaker bone. So it's always important to consult prior to starting any sort of exercise program. So exercise in general in cancer has been very strongly supported, and it's been shown to be beneficial for a number of different reasons. So it's been shown to reduce feelings of depression and anxiety, increase energy and strength, improve bone health, and prevention of osteoporosis. So that's a really important one. And the way essentially you do that with exercise is by doing exercise on your feet. So where you're weight bearing, and that really helps to stimulate stronger bone. It's also been shown to improve cancer-related fatigue, reduce side effects of chemotherapy, and improve balance. So essentially having a lower risk of falls and fractures. So kinesiologists, their role essentially is to guide you in adopting and maintaining a healthy and active lifestyle. So they will provide you with an individual exercise program, again, highlighting individualized, that takes into account your current health status in addition to your past and future one, but also takes into account your goals. So whatever your goal may be, if it's to walk quicker, if it's to get back to running, if it's to get back to swimming, they will create a program designed to meet your specific goal. And the way that exercise, they really work on improving your cardiovascular system, your endurance and strength, your pain and stress, and your fatigue levels as well. And lastly, there's osteopath. So this is an area of healthcare that is driven by the principle that our body tissues, our organs, and our organ systems are all interconnected. So that if you have a problem in one area, there's kind of like this domino effect that occurs in the rest of your body. So what they do is that they use very fine and precise palpation, so touch, to investigate your whole body. So they look at muscle, nervous tissue, organ systems, cardiovascular systems to understand the source of your pain and limitations. And using a very gentle approach, so gentle manual approach, what they do is they help you to restore the function of body tissues and balance of all the systems. So they help your body to find balance essentially following some sort of trauma, surgery, or medical condition. And with that, they facilitate overall health and well-being. So that just gives you a little bit of an idea about what each professional's role is in cancer rehabilitation. And like I said, we really work as a team. There's something that myself as a physio that I can't do, so I often refer to an osteopath or occupational therapist. So we really work together as a team, and all the services are very complementary. But like I said, not all my clients need every single service either. It really depends on your needs and concerns. So our rehab services are located in quite a few of our clinics in Montreal. We're also located in the Montérégie area and the Laurentians, in addition to Quebec. But these are really the clinics that offer those cancer rehab services. We have a number of other clinics who unfortunately do not have this service as of yet, but this provides you with a good list of where you can find our services. So I thank you all very, very much. I'm going to turn back to Gabriel just to see if we have any questions.
Hi, Amanda. Thanks for that. That was lots of information. So yeah, we do have a few questions. The first one's pretty simple. I'm not sure if you mentioned it, but do you need a prescription to access your services?
Great question. So not at all. We are first-line healthcare professionals, so you just have to call the clinic and you could just book an appointment with any of us.
Okay, great. Next question I have is, you talked a lot about from the continuum of care and from diagnosis to post-treatment, and obviously with myeloma, post-treatment doesn't really exist. It's usually active treatment all the time. But going back to from diagnosis, can you speak to maybe about, for example, timing of physiotherapy, at diagnosis versus, after treatment? Are what does science say? Are the benefits the same? If for someone who starts physio or starts these types of things before the treatment or after the treatment?
It's a great question. So there's been actually so much research that's been done in cancer rehabilitation, specifically cancer prehabilitation. So that means rehab before you start your cancer treatments. And what research ends up showing is that prehabilitation actually helps so much to prevent a lot of the side effects from even appearing. And the biggest ones being kind of the weakness, the fatigue, loss of strength. Of course, with chemotherapy, there's so many side effects that in rehabilitation we cannot prevent. However, it has been shown that we can lessen a lot of the impact of the side effects.
So milder symptoms.
Exactly.
Or ability to cope with symptoms better.
Exactly.
Okay, that's good to know. Lastly, it wouldn't be 2020 if I didn't ask you about how COVID has changed your your practice. So if you could maybe talk a little bit about how your services have adapted because of the pandemic.
Yeah, definitely. So, I mean, definitely the pandemic has been a little crazy for all of us, as I'm sure you could all imagine. So essentially for us, what we've put in place is a tele-rehab service. And what that means essentially is that we are virtually able to meet our clients now. And it happens over a platform called Zoom. So essentially how that works is our clients call the clinic and they could either ask for an in-person appointment or an appointment through tele-rehab. And they are sent a link on Zoom and you meet with your therapist face-to-face on video or no video if you prefer. And through that, your therapist is able to really ask you all the questions that they would in clinic, and they'll do an assessment by having you move in certain different ways. Telerehab for us has proven to be great service for educating our clients, for giving clients exercise programs, and for really providing guidance. Of course, it's limited in terms of what we can do as therapists hands-on, but specifically for a myeloma community, it's great because we're able to provide our clients with what they need, which is mostly education and how to move to prevent fractures, and exercises on how to prevent fractures, and changing your posture so that you're more comfortable in preventing injury. So it's a great platform for us to use. So we've definitely implemented that through COVID.
Awesome. And you know, because you're doing things remotely, are those services limited to you know, for example, Quebec, or can someone from another province perhaps take advantage of a remote session?
Yeah, so another good question. So unfortunately, because we are licensed therapists in Quebec, we could only treat residents of Quebec. So that's one of the big downsides, unfortunately. However, if someone is a resident of Quebec and they're living out in Ontario or Alberta, we can definitely see them. And another important point is that those telerehab services are actually covered by private insurance, just as if you were coming to the clinic.
Oh, it's great to know. So I don't have any questions here. I see someone has raised their hand, but we don't usually do questions audio during webinars. So I'm gonna just give this person a few seconds if they want to type in their question in the chat or in the question box. So we'll give them like maybe 30 seconds or so, and if not, we will end the webinar there.
No problem.
We'll just wait a few seconds here. So I guess while we wait, how long have you been, you know, doing physiotherapy?
So I've been a physiotherapist for 4 years, and actually prior to becoming a physiotherapist, I used to work in cancer care. Specifically, I used to work at a private breast cancer clinic as a surgical coordinator. So my role was essentially to meet with everyone who was diagnosed. And it was from there that I was pushed to return to school and pursue another degree in physiotherapy. So I've been, I graduated from my master's 4 years ago, and I've been practicing since then.
Oh, that's great. It's you know, it's definitely a very interesting you know, profession, and also can be very rewarding as well. So
it is.
So with that, so I guess there was no extra questions. So with that, I wanna thank you for taking the time again, and hopefully we'll be able to connect again for a future meeting, hopefully in person in Montreal, so that we can you know, we can share your services with the Quebec people in Quebec. So thanks a lot.
Definitely, and I thank you again for having me. And if anyone has additional questions, my email address is there. Please feel free to reach out to me. I'd be happy to answer any other questions.
That sounds great. Thanks so much. Have a great day.
Thank you, you too.
Thanks. Bye-bye.